Today I would like to demonstrate the correct use of the sickle scalers, posterior and anterior. The anterior sickle has one curve with a pointed tip for the line angles of the anteriors. The posterior has many curves with two cutting edges and a pointed tip for obviously the line angles of the posterior teeth. So 5 points that I'm going to make today are angulation, adaptation, activation, positioning of the clinician, and fulcrum placement. Fulcrum placement for to maintain the position of your instrument and to also prevent any type of injury to the gingiva. So I'm going to start with, one point I would like to emphasize also is the sickle scalers are only used for subgingival, moderate, heavy calculus removal. I'm going to start with the posterior scaler. So for adaptation, the tip third of the cutting edge against the tooth, it should be parallel to the long axis of the tooth, starting at the distal line angle. So I can already see that this is the wrong way because it's crossing over the tooth. It's not parallel. So the right way to do this is to start at the distal line angle with light lateral pressure. Your fulcrum placed on the lingual of 30 or mesially, whatever you want to do. Light pressure. Then you're going to roll your instrument until you are parallel with the tooth. The angulation of your instrument should be at a 70 to 80 degree angle. And it's always a modified pen grasp. You see how I have my thumb, this finger, my fourth finger, and then my ring finger is my fulcrum. So for the anterior sickle, for me personally, I always go to the 9 o'clock position. So I'm sitting beside the patient, in front of the patient. I go starting at the distal line angle, light lateral strokes with my fulcrum in place. My fulcrum is always my fourth ring finger. Light lateral pressure, rolling your instrument until you get right into the interproximal of the tooth. Okay, so finally today I'd like to talk about the learning theories that I thought were the theories that were utilized in the video demonstration. So behavioral, because I think behavioral theory is when a student is given positive feedback, it will enhance their learning ability. Transformative or the reflective learning theory, which I like a lot, the reflective learning theory, because I used it a lot myself. That's when you're experiencing and using the scalers. This is how you become better, practicing the use of the scaler. And also self-reflection, which allows you to for a new clinician to look back and be able to understand the reasons why the scaler is used in a certain way and realize why adaptation, angulation, and activation is so important.